Hi, I'm Janet Brindley and I've been teaching the Buteyko technique for over 20 years. Some questions following on from the stop cough exercise. Do I need to cover my mouth for 30 seconds? Well, the answer is yes, if you want to break your cough habit. The Buteyko Stop Cough is different from other approaches because it brings together several techniques, making it more powerful. There's the immediate action to try to stop the cough before it even starts by bringing your hand over your mouth to prevent mouth breathing. Smother, you say to yourself, and your brain is now engaged and focused on following through the other steps. Swallow. You can't cough and swallow at the same time. Stop. Hold your breath for a few moments. Even a small movement of air can sort of tickle your throat at this stage. Then for around 30 seconds, take small, smooth breaths. As you know, the idea is that you're bathing your throat and lungs in warm, moist air. I see people who cough every 2 or 3 minutes, but are completely unaware of it. By following the steps of the stop cough exercise, it focuses the mind on the cough. Should I use the stop cough if I need to cough up mucus? Yes, everyone produces mucus in their airways. It helps to protect the airways from drying out, and it traps dust and other particles. Now, normally the mucus in our lungs passes unnoticed down the back of our throat. But when the amount of mucus being produced increases above a certain point, we start to develop a productive cough. Now, coughing up mucus isn't always a sign of infection. It can be caused by allergy or cigarette smoke without any germs being present. And in this case, there's no problem using the stop cough exercise to prevent further coughing. In some cases, clearing the mucus may be helpful to prevent further complications. And your doctor or physiotherapist may have advised that you use a controlled coughing technique, such as the ACBT or huffing at set times during the day, perhaps every couple of hours or perhaps twice a day. Now, these techniques help to clear mucus from the lower lungs more effectively than normal coughing. And there's a short video on how to practice the ACBT in this playlist. You can use the stop cough exercise immediately after a controlled coughing session to prevent yourself coughing again, and also use it between controlled coughing sessions. And this should substantially cut down the number of times you're coughing during the day. Continuous coughing is really tiring and hard on the lungs, so try to only cough during your controlled coughing times and use the stop cough the rest of the time. Having used this technique myself, I think one way it works is that you become so fed up of having to wait that 30 seconds that you make every possible effort not to get to that point. And through practice, I found I could pick up a really early first feeling of a cough, quickly swallow, hold my breath, all in a matter of seconds. Is there anything else that might help a cough? Well, many patients report that sipping water or sucking menthol lozenges or menthol and liquorice lozenges is helpful and reduces the frequency and intensity of their cough. There are many causes of cough and not all of them will be completely eliminated by this stop cough exercise. If you don't notice any improvement after a couple of days, then it can be useful to keep a diary of your cough. Note down if the cough is usually better before or after meals, whether certain foods set it off. Are you worse out of doors or better when you go into the office or when you're on holiday? If you've recently started new supplements or medications, then note this down. Passing this information on to your doctor may help him or her to understand where the cough is coming from. I was given some blood pressure medication several years ago and after a few days developed a cough. The desire to cough was very quick and impossible to resist, a really tickly feeling in my lungs. I couldn't completely control it with the stop cough exercise. And when I reported this to my doctor, I was given a different formulation which didn't cause cough. Okay, thanks for listening. I hope you found something helpful here. Bye now.